Hi, I'm Meredith Marr at the University of Maryland Children's Hospital. Today we're discussing breast lumps and testicular masses with pediatric general surgeons Dr. Helena Crowley and Dr. James Moore. Thanks for being here today.
It's our pleasure.
And thanks to all of you for watching. We invite you to leave your questions for Drs. Moore and Crowley in the comment section below, and be sure to like this video if you're watching right now. Dr. Crowley, can you explain to us what breast lumps are and what some of the possible causes are?
Sure. First off, thank you for having me and welcome everyone. My name is Helena Crowley and I'm happy to be here. There are a number of reasons infants and children can have lumps in their breast. Some of the reasons are just part of normal development. They can be variations on normal development. They can also be acquired conditions such as infection, for example. As far as normal development, some infants, when they're born, there's some residual maternal hormones that can cause some stimulation of the breast tissue. We see that. We also see some older infants and toddlers who can have very early breast tissue development that typically resolves on its own. In addition, we can see a lot of boys going through puberty who have breast tissue development. That's pretty common. Those would be some, generally some parts of normal development of breast tissue. Some variations would include the development of some masses, including things like cysts that can develop during the normal part of puberty when the adolescents are developing their breast tissue, girls are developing breast tissue. They can also develop masses from a proliferation or an overgrowth of normal tissue, masses that might include something called a fibroadenoma, which is probably the most common type of breast mass that we see in adolescent girls. That's an overgrowth of the lobular, the glandular tissue of the breast. We can also see some conditions that are acquired, as I mentioned, such as infections. So you can develop a breast abscess, or if there's a trauma to the breast tissue, you can develop necrosis, which can scar and form a mass as well.
So lumps can affect both boys and girls?
Absolutely. The infectious causes that I mentioned could affect boys and girls. The lumps that I mentioned, fibroadenoma, we would typically expect to see in adolescents and girls. Gynecomastia can affect actually over 50% of boys during puberty. But yes, certainly lumps.
And explain to us what that is exactly.
Sure, that's a proliferation of the breast tissue that we can see in boys that we don't entirely understand why it can occur, but it's kind of troublesome. It typically resolves on its own. There are cases where it can be sustained, or cases where it's associated with other, like a pretty significant growth of the breast tissue, or other signs that might be more concerning and involve a more thorough workup. But certainly a physical exam, a complete physical exam for adolescent boys, including exam of the testicles and that sort of thing, would be warranted. If there was any concern, further imaging and an endocrinological exam would be indicated.
Dr. Moore, is there ever a correlation between a breast lump and a testicular mass? Is there ever a situation where maybe someone has both and it's caused by the same issue?
I would say it's not that common, but in certain abnormalities where you might have hormonal stimulation of reproductive tissue, you might see stimulation of both the breast tissue and the scrotal tissue. But usually the types of testicular tumors that boys get aren't necessarily associated with breast masses.
And at what point should a parent or even the child themselves be concerned about their breast lump?
I think if there's any concern, that should be addressed with certainly the pediatrician, and if indicated, refer to a surgeon. But basically, if there were signs such as an infectious cause, if there was pain associated with it, if there were overlying skin changes like redness, and that needs to be addressed because the infection might not self-resolve. If there were issues such as the breast lumps that I mentioned that we see in girls might be concerning because they're painful or they're rapidly growing. Certainly if there were overlying skin changes or associated with lymph nodes or something like that, which would be very rare, but that would warrant a further workup.
So most of the patients that you see, are these lumps self-reported, or is this something that pediatricians are looking for during an annual exam?
I think it's probably a combination of both, but it's often in the younger children, infants and toddlers, mothers and fathers and the caregivers are reporting it. And then certainly in adolescents, that sometimes is picked up during a routine physical exam by the pediatrician.
What are some of the treatment options for a breast lump?
It certainly depends on the cause, but infectious causes in infants, that we're a little careful because we want to avoid any injury to the breast bud. So in cases of infection or an abscess, a pus pocket in an infant, we might be inclined to do a needle drainage. If it's worse and warrants more intervention, we can actually make a small incision and drain it that way. Other lumps, for example, fibroadenoma, again, very common. Something like that, if it is very large, if it's causing persistent pain, if we have concerns about what exactly it is, then we can offer a removal of a lump, lumpectomy. And we can do certain things, for example, hiding the incision in the areola. That's nice so that we can try and limit any of the scar and make it a nicer aesthetic outcome for the child.
Is it possible that a breast lump will return once it's been removed?
That is a possibility. We see, for example, with cysts, sometimes they can be aspirated and they can come back. There is an unusual entity, but it can impact children, something called a phylloides tumor that can recur if some of the residual tumor is left. A breast abscess, if it's drained and there's still some residual abscess or bacteria, that could recur as well. So with most of them, there is a possibility it could return.
So you mentioned with younger children, you try your hardest to not affect the breast bud. Is that because there's a chance of maybe the breast being two different sizes during development, if there is a lump in the breast when they're younger and removed?
Definitely. Basically, we want to do our best to try and limit any change to the architecture of the breast bud, because that could ultimately impact the shape of the breast, and if there was significant injury to that. So, for instance, even children who aren't being evaluated for a breast lump, or who might be under our care for other things like a placement of a line or something like that, we take great care to avoid injuring the breast bud so that in the future the breast can develop normally and not disrupt the tissue.
Great. Let's take our subject on to testicular masses now. What is a testicular mass, and what are some symptoms of one?
Well, when people hear the word mass, they usually get very nervous because people tend to associate the word mass or tumor with cancer. And the good news in children is cancers are fairly uncommon. So when people talk about testicular masses, a lot of times a patient will come in because there's scrotal swelling, and they'll identify that as a mass. The good news for most patients is that scrotal swelling is usually a benign entity. Probably the more common things that cause scrotal swelling are things like hydroceles, which is just a benign fluid collection in the scrotum, which in younger children sometimes just goes away without therapy. Obviously, sometimes people can develop a hernia, and that might be diagnosed as a mass for somebody who's not familiar with a hernia, and it's just a benign entity which can be fixed fairly quickly. So fortunately, testicular masses are fairly uncommon in children, but they can occur, and it's important to get an appropriate workup for those masses when they do.
Can they occur in any age of a child?
They can occur in any age. There tends to be 2 times in a child's life when they're most common, and that is in the first couple years of life. And then there's a second period of time when they're at higher risk, which is kind of in the peripubertal, postpubertal period. So those are the times when we tend to see patients with masses. Oftentimes an antecedent mass isn't picked up until a child's had some type of scrotal trauma or something draws attention to the scrotum, such as an annual physical exam by the pediatrician, and the doctor that normally sees that child will pick something up, because oftentimes when there is a scrotal mass, it's asymptomatic until someone's actually felt it. So it's something that's usually picked up by an exam.
So this might not be something that's painful to the person. They might not even know that they have it.
That's exactly right. Something like a hernia, where you have abdominal contents coming in and out of the scrotum, is usually a lot more symptomatic, whereas a true mass oftentimes is asymptomatic. Sometimes they'll come to light if a child's involved in some type of sporting activity where they maybe sustain an injury to the area and something hurts, and then somebody will say, there's something here as well. And sometimes that's related to the trauma, but sometimes it's true unrelated, meaning that there was something there and it was the injury that drew attention to the area.
Is it possible for a mass in childhood to manifest differently than a mass would in adulthood? A testicular mass, are they different, or do adults and children ever share the same type of mass?
Well, certainly there is the possibility that a child could develop a similar type of mass that an adult would, but the thing that's important about the pediatric surgical specialty is that the types of tumors that children get do tend to be different from the type that adults get. So that's why it's critical oftentimes to be treated by someone who's familiar with those differences.
Is it the same for breast lumps? Very different from childhood to adulthood?
I would say that's accurate, absolutely, and that's important to reassure parents if they're obviously they're going to be worried when we're talking to their child about a breast lump, that the cases of it being something not benign, something like cancer, is really low likelihood. Even with an adolescent girl, the chances are it's probably a fibroadenoma. It might be a phylloides tumor or some of the other entities we discussed, but something like a true breast cancer is quite unusual. It has been seen in children. It's certainly been described, but that's an important part of the physical exam and just the workup and excluding that. But it's unlikely.
Right. What are some treatment options for testicular masses in children?
Well, the critical thing, obviously, is to differentiate between what you feel might be a benign mass and what might be something more potentially dangerous. And so one of the best modalities we have for evaluating that is an ultrasound. Fortunately, the testes are fairly accessible from the standpoint of being able to image them, and ultrasound technology is a great modality. It does not involve any ionizing radiation, and can really help us differentiate between things like a simple cyst, which we would diagnose as a hydrocele, or a hernia, versus actually a true mass, meaning solid tissue within the testicle itself. In the case where you've ruled out a hernia or a hydrocele, and you're dealing with a testicular mass, it's critical to kind of decide whether you think you're dealing with a potentially dangerous mass or something that's benign. Sometimes the sonographic characteristics, meaning how that mass looks on the ultrasound, can give you some clues as to whether it's malignant or not. But anytime there's any question of malignancy, you always assume malignancy first and treat it as such. And so if you have a true solid mass in the testis that's not related to one of these more benign phenomena, it's very important to treat it as a malignancy until you've proven otherwise.
How can a testicular mass affect fertility later in life?
Well, the good news is testes continue to produce hormones and sperm throughout a patient's life or throughout a person's life. And so even if you lose one testicle, you still have close to normal fertility and all the normal developmental hormones you'll need. So if just one side is affected, the answer to that is it won't affect fertility much at all.
Okay, great. Before we continue, we'll do some introductions behind the camera. We have Hannah Braun and Aaron Rummel, both from the Marketing and Communications Department at the University of Maryland. Aaron, do you have any questions for us from the audience?
I do. Good afternoon. My son was recently hit by a soccer ball, sports injury. Should she be testing for testicular lumps?
That's a great question. Oftentimes people wonder, is there something I do or is there some risk for something that has occurred to me that put me at risk for a testicular mass or cancer? But that's fairly uncommon. Usually these things develop based on some abnormality of the testis itself. So while a trauma to the testis sometimes draws attention to a mass that was already there, it's very unlikely that the trauma itself would cause a mass to occur. So unless you have significant swelling or ongoing pain related to a trauma, if everything gets back to normal after a day or two, I would have a low suspicion there's anything to be concerned about.
Is that the same with breast lumps? Say you're playing soccer and you chest try to fall very hard, or maybe someone elbowed you, you're playing basketball, whatever, and you get hit very hardly in the breast.
Well, there is certainly the possibility that some trauma was sustained to the breast tissue and could result in some bleeding or even necrosis of the tissue. So there is that possibility. But if there was a lump there of the type that we had previously discussed, I think it wasn't necessarily related to the trauma, but it can be sort of more readily observed because now there's attention drawn to the area.
Okay, great. Before we take more audience questions, just a quick reminder to please leave your questions for Dr. Moore and Dr. Crowley in the comments section below. Aaron, let's take one more question.
Can breast lumps be prevented?
Oh, that's a really good question. Can they be prevented? I would say, generally speaking, the answer to that is no. Of the categories that we had discussed, the sort of some of the developmental causes for breast tissue, like hormonal changes, that can't likely be prevented. There are certain medications that have been associated with some of the proliferation of breast tissue. So if there was a concern that all the causes for the breast tissue were excluded, and then sometimes physicians or the primary care doctors might recommend removing or stopping some of the medications. So that's a pretty specific example of maybe where a breast enlargement could be prevented. But generally speaking, the developmental causes or some of the cysts or masses that we talked about, including the fibroadenoma, it's pretty unlikely that those could be prevented.
Does diet affect breast lumps or testicular masses at all, the development of them?
Diet can affect some of the breast pain that sometimes adolescents can experience. So certainly one of the suggestions for adolescent girls that are experiencing breast pain, we recommend stopping caffeine intake, because that can sometimes improve the breast pain, but not necessarily. So I would say that it has a minimal impact on breast lumps.
And I would say the same is true of testicular tumors. I can't think of anything offhand that you would eat that will put you at higher risk for development of the type of testicular tumors that we'd be worried about.
What about supplements? Any supplements that can prevent lumps or masses, or even potentially cause them? I know you mentioned some medication that may cause them, but are there any natural herbs or anything that you would recommend people take or not take?
Yeah, I am not aware of any.
Yeah, I would say that herbal remedies aren't really regulated by the FDA, and so kind of knowing what's inside some of these remedies, it's hard to make a recommendation for or against them. Certainly with both breast lumps and testicular lumps, any type of medicine that you would take that would have hormonal activity could theoretically stimulate the breast buds, as Dr. Crowley talked about, or the testis. But in the absence of those components in a hormonal or a supplement, I don't think there would be much effect on either the breast or the testis.
Okay. Erin, do you have another question?
Absolutely. Can breast lumps cause long-term issues like an inability to breastfeed?
Great question, and theoretically they could. If you had there's some of the lumps that we talked about, particularly the phylloides tumor, very unusual, but those can grow very large, and if those needed to, on removal, that could disrupt a significant amount of the breast tissue and might impact the child's ability later in life to breastfeed on that side.
Okay, great. For those viewers, parents, even maybe teenagers who are watching and still have concerns about their breast lumps or testicular masses, what do you suggest for them next?
Well, our telephone number for our office it works 24/7. During the office hours, you'll get one of our office staff who can usually get you set up with an appointment to see us. There are 5 people in our group. We not only see people here at University of Maryland, but we go as far east as Easton, Maryland, across the Chesapeake Bay Bridge, as far north as Bel Air, Maryland. We're up in Towson. We're down in the Columbia area off Route 100. And we usually can get you into the office pretty quickly, particularly if there's a concern about something that's more acute. So when you call our office, you'll get a hold of one of our secretaries or our nurse practitioners who will quickly triage what's going on with you and your child and determine how quickly you need to be seen and make that happen for you, close to wherever you live.
And what's the phone number for us?
It's a 410-328-5730.
Okay, great. For those of you who are watching and still have questions, please feel free to leave them in the comments section below, and we'll get back to you within 48 hours. Thank you.
Thank you.